I want to thank Taiwan Biotech, and also I'd like to thank Daiwa Pharmaceutical for this opportunity to speak. I thought that Dr. Suksupam's presentation was thoroughly excellent and really covered the material very well. I have practiced acupuncture. I trained in Japan, so that's a part of my connection there. A number of years ago, and I've been a clinician for 40 years using Chinese herbs, Western herbs and essential oils, nutraceuticals and German biological medicine. And I feel like there are many situations where it's possible to avoid a medical approach and to avoid using pharmaceuticals. So this is always the angle that I'm working from. I work in a clinic where we use intravenous ozone for treating cancer. And the doctor that I work with actually went to Africa and treated Ebola virus patients with ozone with great success. And we've seen good success using ozone in the clinic along with intravenous therapy, especially vitamin C in treating COVID cases. So I wanted to mention that, but that's not what I'm going to be talking about today, because I'm going to be talking about approaches and supplements that are much more accessible to everyone without having a very specialized practice. So this first part is about infection in general, and I want to talk about some basic natural medicine principles and a little bit of history before we get into talking about COVID itself. So I'd like to also like to thank in particular Ms. Yasuko Kikuchi, who's helping me with the slide presentation. So I'd like to see the next slide, please. So let's talk about what an infection is and what the cause of infections are. Of course, we know about microbes, bacteria, viruses, fungi, parasites, and prions. Another important cause of infection is trauma. Now, the main cause of late death from trauma is infection. Late death means that if the blow on the head didn't kill you, if you didn't bleed to death, 4 to 6 weeks later, it's not unusual to have an infection and to die of pneumonia. And the reason for this is the third factor here, which is low immunity, impaired phagocytosis. So the low immunity can be caused by the trauma, and we'll discuss the mechanism for this. I think Dr. Suksupam touched on this a little bit. So let's look at the next slide, please. Now, I'm talking about cancer right now because I think that we've reached a turning point with cancer therapy. Chemotherapy is often given to prevent metastasis, but only a small fraction of patients will metastasize. But everyone gets the chemotherapy because we don't know who it's going to be that will have metastasis. The search for cancer genes and metastasis genes has been futile in terms of treatment success. Cancer's metastases depend on local conditions, that is, the seed. In 1889, Dr. Stephen Paget published an article about the seed and soil hypothesis. Metastasis is a result of the interaction between cancer cells and their environment. Now, this idea has been dormant in the mainstream, but there was an article in a national magazine about a year ago by a very prominent oncologist named Siddhartha Mukherjee. He wrote a classic book called The Emperor of All Diseases, which is about cancer. And in this article about a year ago, Dr. Mukherjee said, we've been taking the wrong approach. We've been analyzing tumors, breaking them up, looking at them microscopically, trying to treat the seed when we should be concentrating on the soil. So let's look at the next slide. The seed versus soil controversy can also be translated into the subject of infection. The scientific debate about the cause of infection centered around the concept of the germ. In this case, the germ is the seed, and the terrain, concept, the soil. The terrain was a term that was used to describe the whole body's condition. Louis Pasteur insisted that the cause of infections is the germ, but the prominent physiologist Claude Bernard maintained that the cause of infections is the terrain, that is, the microbial habitat and the host's susceptibility to infection. I'd like to see the next slide, please. So Pasteur became famous because he ended the controversy on spontaneous generation and discovered the importance of microbes in the origin of disease, and also worked toward developing new vaccines. You see the next slide, please. Like, see the next, yeah, this is Claude Bernard, who is also very famous. Of course, Pasteur was the most famous biologist, but Claude Bernard wrote, "The stability of the internal environment, which he called the milieu intérieur, is the condition for the free and independent life. This is the underlying principle of what Walter Buchanan later called homeostasis." So next slide, please. The terrain is a core concept of natural medicine. Pasteur popularized the germ theory, but Claude Bernard said that it's not the germ, it's the terrain that's important. And there's a famous story, and I spent time researching to see if this was really true, but Pasteur admitted on his deathbed that Bernard was right. He said on his deathbed, the germ is nothing, the terrain is everything. So they're discovering this now in cancer. And I think in infection, it's of equal importance to not just try to kill germs, but to change the condition of the host. And so that's an important principle that I want to explore more today. So if the terrain is a condition of the whole body, how do we evaluate it? Let's look at the next slide. Oxidative stress. Oxidative stress is an aging factor. It damages membranes, proteins, and DNA. Oxidative stress causes aging and degenerative disease when the body loses its capacity to neutralize and detoxify reactive oxygen species, which are byproducts like free radicals, or to repair the damage that they cause. So how do we evaluate oxidative stress? Two of the most well-studied markers are from lipid peroxidation. There's also flow cytometry, chemiluminescence assay, and there are a few alternative medicine ways of evaluating oxidative stress. One of them is using the dark field microscope to observe the formation of rouleaux, which are red blood cells or erythrocytes are stacked up like poker chips. Another is the oxidative dried blood test, which is where a sample of blood is taken onto a glass slide and then allowed to coagulate and then examined under a microscope to see how much deterioration there is. And then there's a device called the FORM device. FORM is FORM, which stands for Free Oxygen Radicals Monitor. So another way that we can evaluate the terrain is the level of inflammation. Let's look at the next slide, please. In chronic inflammatory diseases like diabetes, the proliferation, differentiation, distribution, and function of the innate and adaptive immune systems becomes dysregulated, and the immune homeostatic balance becomes disrupted. So these in turn make patients more susceptible to be infected with SARS-CoV-2 and more severe outcomes. So the severity of the disease can be predicted, in my opinion, if oxidative stress is high and if inflammatory markers are high. If inflammation is already high when there's an infection, then it's very possible that we're going to see much more severe acute symptoms. And not only that, not only will there be more severe acute symptoms, but a greater likelihood of long COVID. So how do we evaluate inflammation? There are several ways. There's CRP, which is C-reactive protein, which is a general inflammation marker. There's ESR, the erythrocyte sedimentation rate. And then what I like to use is what's called the Glasgow Prognostic Score. In Glasgow, Scotland, at the hospital, they were curious about the cancer patients because some cancer patients would be at stage 4 and live for 2 or 3 years. Other people would be at an earlier stage and they'd be dead in 5 or 6 weeks. So what made the difference? And so they examined medical records of literally hundreds and hundreds of cases and decided that the key factor was inflammation. And so they created the Glasgow Prognostic Score, which is C-reactive protein divided by serum albumin. And you want to have a ratio of less than 1. The higher it is above 1, then the more inflammation there is that's ambient throughout the entire system, throughout the terrain. And so this makes prognosis worse. Now, it was used originally for cancer, but now it's being used more with cardiovascular disease, and I use it for just about every patient with chronic disease. I like to know what their level of inflammation is. Let's look at the next slide now. Another important factor is glycation. Glycation is uncontrolled reaction of sugars with proteins. Increased glycation results in tissue destruction, oxidation, cancer, and premature aging. In acute conditions, sugar consumption reduces immune system function and increases susceptibility to infection. And we know from statistics in America that 80% of the people that have been dying from COVID are obese or diabetic or both. Now, I don't think in Thailand you have the problem with obesity that we have in the US, but I think diabetes is a problem worldwide. And the sugar factor can obviously be diagnosed with studying with a test for hemoglobin A1C and also serum blood glucose. So these are ways that we can measure glycation. And let's look at the next slide. And there may be other ways to mark the function of the terrain, but the aging of the immune system or the immune function is an important one. Immunological research has identified the physiological basis whereby physical and emotional injury can alter neurological, endocrine, and immunological status and set the stage for chronic illness in previously healthy individuals. A variety of effects on host immunity have been observed, but reduced lymphokine-activated cell and natural killer cell activity appear to be a consistent feature of immune system dysfunction. And these are a part of the innate immune system. So we, of course, routinely do a complete blood count. So we can look at the white blood cells and look at the differential. But another way to look at the immune system properties of fighting infection is NK cell activity test. And the classic one is the chromium release assay, but I think there are new ways that are less expensive for testing the NK cell activity. So I'll be talking more about the natural killer cells because they're extremely important. One important thing is that it's not so much the number of the NK cells as it is their activity. That's why we're not looking at the count, because the count may be in the normal range, but the activity may be very low. And NK cell activity has actually been used with AIDS patients to determine the prognosis, to determine how long a patient has to survive. So let's look at the next slide, please. So all this is very useful, but can't we just catch a virus? I mean, the germs are important, aren't they? But if the main factor is our immunity, am I saying don't worry about catching a virus from someone else? Well, that's not the case. Any toxic substance can make us sick, including a toxic virus. But the decisive factor of onset or severity is our internal resources, our immune system, which in this case I'm calling the terrain. So let's talk about preventing and treating the flu. Let's look at the next slide, please. Pandemic is a scary word, but new research shows that even the deaths that occurred during the 1918 influenza pandemic were mostly from streptococcal infections and not from the virus. Strep infections could have easily been controlled with antibiotics if they'd been available, but the antibiotics, well, penicillin was only discovered in the early 1931, and it wasn't until later in the 1930s that the penicillin was available. And so treating strep infections could have been possible during that time period if there had been antibiotics available. And the loss of life from the pandemic, the influenza pandemic, was also from weakened immune systems that resulted in tuberculosis. And tuberculosis broke out on a large scale during the First World War and then following the First World War. So this is responsible for a lot of the death that occurred that we can't pin on the influenza factor. Let's look at the next slide, please. So this is just the ordinary advice. As medical professionals, you probably all know all this, but getting extra sleep and rest, giving the body a chance to heal and stopping other activities, getting regular exercise. This is important advice for Americans. We can't always control stress in our lives, but aerobic fitness can prevent its damaging effects on our body and immunity. Emotional balance. Poor response to stress can negate all other beneficial aspects of your program. And we'll see how this affects immunity. Take probiotics every day or have a diet that has live cultured foods, fermented foods. I lived in Japan for a number of years, and every day we had miso soup, which is a fermented food, and natto. I used to love to eat natto, which a lot of foreigners and even Japanese don't like to eat. Another important factor is to keep the bowel moving. If you begin to feel compromised, start taking supplements like MGN3, that's another name for BioBran. Preventing and treating the flu, yeah. Here are some of the other things that I use for treating infections. I use essential oils like oil of oregano, colloidal silver, elderberry. I like using oil of thyme in particular for viruses. And of course, I've used Chinese herbs a lot. And during the bird flu in China, they began to run out of Tamiflu, and they began to use the Chinese herbs, which are the clear wind heat category of herbs, which were found to be very effective for treating the bird flu. And early in the epidemic, the president of China said that the Chinese herbs were really helping control the COVID epidemic. And I think that he was saying that not so much to promote traditional medicine, but simply because it was true. So let's look, please, at the next slide. Stay hydrated, adequate water intake. Other beverages don't count for fluid intake. People here drink sodas, beer, and things like drinks with caffeine, which are also very popular, are going to actually be dehydrating. And let's look at the next slide. Avoid sugar and refined flour products. Sugar makes white blood cell activity sluggish, just as much as stress. And the next slide, please. Sugar reduces immunity. Besides being the driver of other chronic health conditions like diabetes and heart disease, Sugar consumption affects your body's ability to fight viruses or other infections. Killer cells are adversely affected by sugar consumption. Sugar suppresses immunity since the white blood cells are not able to do their job and destroy bad bacteria or viruses. And let's look at the next slide. Sugar impairs phagocytosis. A study at Case Western Reserve University showed that function and not the number of phagocytes was altered by ingestion of sugars. This, of course, is especially true of natural killer cells. This implicates glucose and other simple carbohydrates in the control of phagocytosis and shows that the effects last for at least 5 hours. On the other hand, fasting, not eating for 36 to 60 hours significantly increases the phagocytic index. And this is a quote from a study done back in 1973, that this is not new information. The high blood sugar of diabetes can cause immune system malfunction, triggering infection. Scientists show how sugar-derived molecules can weaken infection-fighting antimicrobial beta-defensin peptides. So this is not a popular thing. My patients get tired of hearing me talk about sugar, but I don't tell them not to use sugar. I just tell them, please don't be addicted to sugar. Use sugar, have fun, drink alcohol, have fun, have a good life. You know, sugar, alcohol, these are things that we should all be able to enjoy. But if you are addicted, it's going to damage your health, and it can almost be guaranteed. So that's why my patients groan whenever I raise the subject about sugar. Can I see the next slide, please? So preventing and treating the flu. Now we're going to get into talking a little bit about important supplements, maintaining adequate vitamin D levels. Sunshine isn't enough in the fall season, and it's important to use a supplement. Now, in places like Scotland and in Scandinavia, and in Canada, every year the Canadian government tells people the flu season's coming, take your vitamin D. And the Canadian government has even done studies on using vitamin D to prevent influenza outbreaks. In the last couple of years, the governments in Scotland, England, Denmark, northern countries have said, take a vitamin D supplement. Traditionally, the vitamin D comes from fish oil because there isn't enough sunshine. And it seems obvious that the flu season is the low vitamin D season, and that the vitamin D can be useful. But we're going to look at what the scientific studies tell us about that. So let's look at the next slide. Dr. Donald Miller, a cardiac surgeon and professor of surgery at the University of Washington, recommends avoiding the flu shot and taking vitamin D instead. According to Dr. Miller, 70% of doctors do not get a flu shot. Health officials say that every winter 36,000 people will die from it, but the National Vital Statistics reports compiled by the CDC show that only 1,138 deaths a year occur due to influenza alone. More than 34,000 of the 36,000 flu deaths are actually pneumonia and cardiovascular deaths. Now, these are statistics from the regular influenza season pre-pandemic. Let's look at the next slide. The cost of taking a 5,000 international unit supplement of vitamin D every day for a year is very cheap. It's probably a little more than that by now, but it would be $6 or $7 billion to give 300 million Americans a vitamin D supplement. And epidemiologists say that could probably save a lot of money and prevent a lot of death. The increased number of deaths that occur in winter, largely from pneumonia, are much more likely due to vitamin D deficiency than to increased prevalence of serologically positive influenza virus, which also results from vitamin D deficiency. Let's see the next slide. So here are two doctors, Dr. Jerry Schwelfenberg, MD, whose name is at the bottom, says that a colleague of mine and I have introduced vitamin D at doses that have achieved greater than 100 nanomoles per liter in most of our patients for the past number of years. And we now see very few patients in our clinics with the flu or influenza-like illness. And those patients who do have influenza, we have treated them with vitamin D hammer, as coined by my colleague. This is a one-time 50,000 unit dose of vitamin D3 or 10,000 unit 3 times a day for 2 or 3 days. The results are dramatic with complete resolution of symptoms in 48 to 72 hours. One-time doses of vitamin D at this level have been used safely and have never been shown to be toxic. Let me also point out that in sunny places, I don't know about Thailand, but in places like the Hawaiian Islands and in Florida, there are very high levels of vitamin D deficiency. And so it's important, I think, to test vitamin D levels for patients who are at risk for infection. Let's look at the next slide. So now we're talking about COVID. September 17th, 2020, a paper in PLOS One, which is Public Library of Science One, found people with lower vitamin D levels in their blood had a significantly higher risk of testing positive for SARS-CoV-2. And here's the reference. And then the next slide, please. An Israeli analysis found that among individuals who tested positive for the SARS-CoV-2 infection, those who had a vitamin D level below 30 nanograms per milliliter also had 1.95 to 2.09 times higher risk of being hospitalized for COVID-19. Other studies have also confirmed that higher vitamin D levels lower your risk of complications and death from COVID-19. Among them is an August 2020 study published in the journal Nutrients, which found patients who had a vitamin D level below 12 nanograms per milliliter had a 6.12 times higher risk of severe disease requiring invasive mechanical ventilation and a 14.7 times higher risk of death compared to those with a vitamin D level above 12 nanograms per milliliter. Let's see the next slide, please. Another study published in the Journal of, let's go back. Go back, yeah. Another study published in the Journal of Endocrinological Investigation in August 2020 found vitamin D deficiency was a common factor among hospitalized patients in Italy who had been diagnosed with COVID-19 related respiratory failure. 81% of the patients with acute respiratory failure due to COVID-19 had vitamin D levels below 30 nanograms per milliliter, and 24% had severe vitamin D deficiency. When looking at mortality rates after 10 days of hospitalization, it was found that those with severe vitamin D deficiency had a 50% probability of death compared to 5% among those with a vitamin D level greater than 10 nanograms per milliliter. This is a 10 times higher risk of death among patients with severe vitamin D deficiency compared to patients with vitamin D levels greater than 10 nanograms per milliliter at 10 days of hospitalization. Next slide, please. Now, there was another study that was done in Denmark, I believe. I couldn't find that one, but a similar study that showed that people with normal vitamin D levels didn't go to the hospital, and almost everyone in the hospital had the low vitamin D levels. So we're going into part 2 because I've got a lot of slides. So we'll go ahead and begin part 2 right now and continue it when, after our break. But let's keep going. SARS-CoV-2 infects the host using the angiotensin converting enzyme 2, or ACE2 receptor, which is expressed in several organs, including the lung, heart, kidney, intestine, and nervous system. ACE2 receptors are also expressed by endothelial cells. Particularly, of particular importance are the mucous membranes. ACE2 is a key regulator of the renin-angiotensin-aldosterone system. SARS-CoV-2 causes ACE to ACE2 balance disruption and RAAS activation, which leads ultimately to COVID-19 progression, especially in patients with comorbidities such as hypertension, diabetes, and cardiovascular disease. So there are actually two angiotensins. There's angiotensin 2 and angiotensin 1.7. And the COVID virus throws off the balance between them. And angiotensin 2 raises blood pressure and constricts arterial blood flow, whereas angiotensin 1.7 lowers blood pressure, but it's suppressed by the presence of COVID. So let's look at the next slide. So ACE2 is present in all people, but the quantity can vary among individuals and in different tissues and cells. Some evidence suggests that ACE2 may be higher in patients with hypertension, diabetes, and coronary heart disease. Studies have found that a lack of ACE2 in mice is associated with severe tissue injury in the heart, lungs, and other tissue types. Let's go to the next slide. So the effect of COVID on ACE2 receptors and respiration are probably the most conspicuous, because the respiratory symptoms have been the most apparent and the most life-threatening, at least in the short term. Some of the cardiovascular effects are perhaps more life-threatening in the long term, and we'll discuss that next. But when SARS-CoV-2 is attached to ACE2, its expression is reduced, thus causing lung injury and pneumonia. When the virus attaches to the cell, it knocks out the ACE2 enzyme because the spike protein is now bound to it. This increases reactive oxygen species in the cell. It also increases white blood cell production, and that increases ROS as well. The end result of this elevated oxidative stress is blood clots, which in turn leads to hypoxemia, low oxygen. Vitamin D3 is a negative RAS modulator by inhibition of renin expression and stimulation of ACE2 expression. It therefore has a protective role. So here we see that blood clots are a factor even in the respiratory system, the microclots. The exchange of oxygen and carbon dioxide between the lung and the blood vessels occurs across the epithelial lining. And it's found particularly in the type 2 pneumocytes, which are called the alveoli, where oxygen is absorbed and waste carbon dioxide is released. So next slide, please. On the vascular system, the spike protein binds to the ACE2 receptor on platelets. The subsequent activation of the platelets can lead to disseminated intravascular coagulation, which is a pathological overstimulation of the coagulation system that can result in abnormal and life-threatening blood clotting, as well as thrombocytopenia, low platelet count, and hemorrhage. And the hemorrhage causes not because the blood is thinner, but because it's thicker, and the erythrocytes clump together, break the capillaries. So one way to find out if this predictable mechanism of clotting is happening is with the D-dimer test. D-dimer is a protein fragment produced by the body when the blood clot dissolves. It's typically undetectable or present only at very low levels, but its level may significantly rise when the body is forming and breaking down blood clots. A number of German doctors have been measuring the D-dimer levels in the blood of patients before vaccination and days after vaccination. And with respect to the symptoms, they have just found out that triggering of clot formation is a very common event with all vaccines. Within 4 to 7 days of patients receiving a COVID-19 vaccine, 62% have evidence of clotting. And here are a couple of studies that don't even include the one that I first found, which was also in Scotland. So the cardiovascular effects, of course, are naturally going to occur when there's a blood clotting problem. The problem you encounter with COVID is when the virus attaches to the cell, it knocks out the ACE2 enzyme because the spike protein is now bound to it. So angiotensin 2 increases, angiotensin 17 decreases, and the conversion from angiotensin 2 to angiotensin 17 can't occur. So that increases blood pressure, and it not only causes coagulation, but it narrows, it constricts the blood vessels, which makes them more vulnerable to clotting, damaging the vessels. So let's look at the next slide. So the vaccine was not associated with an elevated risk for most of the adverse events examined. The vaccine was associated with an excessive risk of myocarditis, and this was 1 to 5 events per 100,000 people. But in 3 countries, I think it was Denmark, Sweden, and Scandinavia, one of the vaccines was banned because there were so many myocardial infarctions in young men in their late 20s and early 30s. No one knows why this is the case, but one has to suspect that there is a hormonal factor with young men in their late 20s and 30s have high testosterone levels. Also, there were a number of athletes who died shortly after vaccination from blood clot related disorders, which would also point toward the high testosterone being a risk factor. But the risk of potential serious adverse events was substantially increased, not only after the infection, but after the vaccine. Excuse me. Next slide, please. Myocarditis occurred in previously healthy military patients with similar clinical presentations following receipt of an mRNA COVID-19 vaccine. Further surveillance and evaluation of this adverse event following immunization is warranted. Potential for rare vaccine-related adverse events must be considered in the context of the well-established risk of morbidity, including cardiac injury following COVID-19 infection. So next slide, please. The mRNA vaccines numerically increase, but not statistically tested, markers IL-16, FAS, and HGF, all markers previously described denoting inflammation on the endothelium and T-cell infiltration of cardiac muscle in a consecutive series of a single clinic patient population receiving mRNA vaccines without a control group. So this was a study that was found without a control group, but the indications show a possible immune system mechanism of increasing inflammation being a factor in blood clot formation. Now, one other important thing to mention about the D-dimer test is that the D-dimer levels, when they're elevated after a cardiac event, they usually go down after a few days. But what the researchers in Germany and in Scotland have seen is that the D-dimer levels after vaccination go up and stay up for months. No one knows how long they'll stay up. Prothrombin time may come down to normal, fibrinogen may come down to normal, but the D-dimer stays up, which indicates that there's some kind of ongoing blood clot formation. So next slide, please. We saw all those tissues in the diagram, but we're only going to talk about respiratory, cardiovascular, and the nervous system today. COVID-19 infection is associated with a number of neuropsychiatric symptoms, including psychosis, even in individuals without previous mental illness. Many of these symptoms have been associated with the COVID-19 induced hyperinflammatory state. So there is inflammation again. Patients with coronavirus disease show higher rates of depression, anxiety, and post-traumatic stress disorder symptoms when compared with non-COVID controls. There are case reports of various psychiatric symptoms in both psychiatric patients and patients with no history of psychiatric illnesses following COVID-19 infection that include manic-like symptoms insomnia, brief reactive psychotic disorders, affective psychosis, suicide, and delirium. A review of the impact of the COVID-19 epidemic estimated that 0.9% to 4% of COVID-19 infected individuals develop psychotic spectrum disorders. Next slide, please. Post-authorization, a wide spectrum of neurological complications is continuously being reported following the COVID-19 vaccination. Neurological adverse events following vaccination are generally mild and transient, like fever and chills. Headache, fatigue, myalgia, and arthralgia, or local injection side effects like swelling, redness, or pain. The most devastating one is cerebral venous sinus thrombosis. Cerebral venous sinus is frequently reported in females of childbearing age, generally following adenovector-based vaccination. Another major neurological complication of concern is Bell's palsy that was reported dominantly following mRNA vaccine administration. And then I'm going to skip down to reactivation of herpes zoster in many people. And actually, I shouldn't have skipped over. I mean, demyelinating polyneuropathy is another neurological adverse complication. So the effect of this on the nervous system, I've seen quite a bit of nervous system damage in my practice, some fairly severe cases of shingles, which is herpes zoster, and quite a bit of polyneuropathy, which manifests mainly as joint pain, and a lot of brain fog. I've seen the platelet levels go down and D-dimer levels going up. And in the clinic where we treat cancer patients, the patients who do get vaccinated seem to take a turn for the worse. So we've been warning people about that. Let's look at the next slide, please. People who had COVID-19 frequently experienced lingering neurological symptoms, including impairment in attention, concentration, speed of information processing, and memory. So this is the so-called brain fog. In the brains of patients who died of COVID-19, the researchers found evidence of inflammation, along with high levels of inflammatory proteins. Here's inflammation again, one of which, CCL11, is linked with impairments in nervous system health and cognitive function. Among 63 patients with so-called long COVID, the researchers found high CCL11 levels in the 48 with lingering cognitive symptoms, but not in the 15 without cognitive issues. They speculate that treatment showing promise for cancer therapy-related cognitive impairment might be helpful for COVID-19 patients with similar problems, but they would need to be tested specifically for long COVID. And the next slide, please. So after the break, we're going to talk about defining long COVID. We'll go over this slide, and then we'll take our break. Over a third of COVID-19 patients diagnosed with at least one long COVID symptom. Fatigue is a dominant feature of both acute and convalescent coronavirus disease 2019, sometimes termed long COVID, with up to 46% of patients reporting fatigue that lasts from weeks to months. The investigators of the International Collaborative on Fatigue Following Infection conducted a systematic review of post-COVID fatigue and a narrative review on fatigue after other infections, and made recommendations for clinical and research approaches to assessing fatigue after COVID-19. So after our break, we can talk about some approaches to treatment. I've seen successful treatment with some of the complications, including shingles, and I've seen good success with treating symptoms and with prevention and in treating vaccine damage. And I'd like to share that with you next. So thanks for your attention, and I'll see you again soon. So I won't read all of this, but 37% of people had at least one long COVID system diagnosed in the 3 to 6 month period after COVID-19 infection. The most common symptoms were breathing problems, abdominal symptoms, fatigue, pain, anxiety, and depression. So a new study from the University of Oxford and the National Institute of Health Research investigated long COVID in over 270,000 people recovering from COVID-19 infection, using data from the US-based TriNetX electronic health records. The study reports how commonly 9 core long COVID symptoms were diagnosed: abnormal breathing, abdominal symptoms, anxiety, depression, chest, throat pain, cognitive problems, brain fog, fatigue, headache, muscle pain, and other pains, usually joint pains. And 37% of people experienced at least one of these. So the difference between the acute COVID and the long COVID, I think, goes back to the condition of the terrain. I've had family members and patients of mine have had COVID for 1 or 2 days with a little bit of fever, a cough, and then it would clear up. And then they would have measurable natural immunity. And I want to talk about the importance of natural immunity shortly. But in people who have high oxidative stress, who have high inflammatory markers, who have blood sugar dysregulation, or who have poor immunity, low white cell counts, or poor NK cell activity, or who are dealing with some type of a physical or emotional trauma, these are the people that become chronic because oxidative stress, inflammation, low immunity, these are markers for chronic disease, for any disease, including an infection. So we want the infections to be acute and not chronic. Let's look at the next slide, please. So this is the importance of natural immunity. And as some of you may have guessed by now, I'm not a big fan of vaccination and feel like there are other ways to approach this problem, and simple, inexpensive ways that I've seen routinely in my practice and that are reflected in the scientific literature. In a letter to the editor of New England Journal of Medicine, Dr. Roberto Bertolini of the Ministry of Public Health of Doha, Qatar, and colleagues estimated the efficacy of natural immunity against reinfection by comparing it data in the national cohort. They found that immunity acquired from previous infection was 92.3% effective against reinfection. Protection persisted even after 1 year after the primary infection. Researchers in Ireland also conducted a systematic review, including over 615,000 people who had recovered, with a maximum duration of follow-up of over 10 months. Reinfection was an uncommon event, they noted, with no study reporting an increase in the risk of reinfection over time. The absolute reinfection rate ranged from 0% to 1.1%, while the median reinfection rate was just 0.27%. So if you've had it, you're not very likely to get it again. If you ever read or hear about artificial immunity being superior, I think that's just propaganda. So let's look at the next slide, please. Another study in Qatar revealed similarly reassuring results. It followed 43,000 SARS-CoV-2 antibody positive people for up to 35 weeks, and only 0.7 were reinfected. When genome sequencing was applied to estimate population level risk of reinfection, the risk was estimated at 0.1%, 1 out of 1,000. There is no indication of waning immunity over 7 months of follow-up, with the researchers concluding reinfection is rare. Natural infection appears to elicit strong protection against reinfection with an efficacy greater than 90% for at least 7 months.
Kener, Dr. Kener, we can't hear you. Your microphone is mute.
Okay, I'm sorry, I accidentally muted and I lost the PowerPoint. So can you hear me now?
Yes, I can hear you now.
Good, I'm back. Okay.
Okay.
So the study in Israel showed the same thing, that vaccination had an overall estimated efficacy of preventing reinfection of 92% compared to 94.8% for natural immunity acquired via having a prior infection. And then the Washington University School of Medicine also shows long-lasting immunity to COVID-19 in those who have recovered from the natural infection. At both 7 months and 11 months after infection, most of the participants had bone marrow plasma cells that secreted antibodies specific for the spike protein encoded by SARS-CoV-2. Okay, next slide, please. So, treatment. Lifestyle, number one, vitamin D, vitamin C, zinc, immune system support, and prevention of thrombosis. Now I want to talk in particular about lifestyle. I've already talked about it a little bit. Vitamin D, vitamin C. I'm not going to talk much about zinc. Zinc has been used for treating colds and viral infections for decades now. And I think probably a zinc supplement is important for most patients. But I'd like to focus on the other factors here. So let's look at the next slide and talk about lifestyle. Besides being a driver behind other chronic health conditions like diabetes and heart disease, sugar consumption affects your body's ability to fight off viruses or other infections. Killer cells are strongly affected by sugar consumption. Sugar suppresses the immune system since white blood cells are not able to do their job and destroy bad bacteria or viruses. So it's the function and not the number of white blood cells that's altered by the ingestion of sugars. This implicates glucose and other simple carbohydrates in the control of phagocytosis, and shows the study at Case Western Reserve showed that the effects lasted for at least 5 hours. Let's look at the next slide. The importance of vitamin D. Low D3 is a predictor rather than just a side effect of the infection. Despite ongoing vaccinations, we recommend raising serum 25 hydroxy D levels to above 50 nanograms per milliliter to prevent or mitigate new outbreaks due to escape mutations or decreasing antibody activity. Vitamin D3 is a negative renin-angiotensin system modulator by inhibition of renin expression and stimulates ACE2 expression. So these are the recommendations of the researchers who carried out this study. Let's look at the next slide, please. The importance of vitamin C. Clinically, it's the most potent antitoxin ever described in the literature, and no reports of it failing to neutralize any acute intoxication when administered appropriately have been published. Continuing persistent and highly dosed vitamin C in all its forms will prove to be the most useful intervention when there is a large amount of circulating toxic spike protein present. Intravenous regular oral forms and liposome encapsulated oral forms are all very useful in resolving any infection and neutralizing any toxin. Ideally, 25 to 75 grams of vitamin C should be given intravenously. This was originally called the Shanghai cure. One infusion will likely resolve acute symptoms. For long COVID, several more infusions are indicated. Now, it's interesting that very early, when the pandemic first began, I kept hearing reports about using the successful use of Chinese herbs for treating COVID. There's no vaccine yet. Intravenous vitamin C was being used. There were clinicians in New York who were using vitamin C intravenously very successfully, even for advanced cases that would normally have gone to the hospital. And there was a doctor who was offering free vitamin C intravenous treatments to healthcare workers who are on the front lines in hospitals treating patients. And the social media shut him down within minutes because there's been a lot of censorship about natural treatments for COVID. And this took place even before they were trying to sell all the vaccines. So the vitamin C, of course, can be used orally up to bowel tolerance, and taken several times a day. You can't always give it intravenously, but it's a very important treatment. Let's look at the next slide. Reducing inflammation. So I want to talk about proteolytic enzymes, which are also called proteases. Most proteolytic enzyme combinations contain bromelain, which comes from pineapple and also is found in noni juice, and papain from papaya. Pancreatin comes from sheep or pork pancreas, and nattokinase comes from cultured soybeans. The enzymes come in tablets, and the dose depends on the size of the inflamed area. There's another source of enzymes called lumbrokinase, which comes from earthworm. And interestingly enough, earthworm is found in the Chinese medicine literature, and it's combined with herbs in some cases. In Chinese herbal medicine, there's a category of herb called vitalized blood, and it's used for treating blood stasis, which is called oketsu in Japanese. I don't know how you say it in Chinese, but blood stasis is blood that's hypercoagulable, and it's found in chronic diseases, and it causes chronic pain and is a threat to the cardiovascular system, and it is generally a factor in any type of long-term illness. So the earthworm and leech is also used in Chinese medicine, along with a variety of herbs for treating blood stasis. But mainly I use proteolytic enzymes because they're less expensive and they're food. They're made out of tropical fruits, or they're made out of organ meat. And so when a cancer patient tells me, oh, my doctor said I can't take any supplements, I say, well, ask him if you can have tropical fruit. Ask him if you can have organ meat, or, ask her if you can have seaweed, or soybeans, or so many other things that can be used effectively, not only for cancer, but for chronic infections. So proteolytic enzymes have been used clinically to treat inflammation, for tumor reduction, and also as a preventive for thrombotic disease. I use them in place of aspirin because aspirin is being discouraged now, particularly for older patients, but the proteolytic enzymes will actually prevent blood clots from forming without thinning the blood. Formation of blood clots is the cause of heart attacks, strokes. Inflammation of the arteries may cause swelling and may be the cause of or contribute to elevation of blood pressure. And they're used more commonly by doctors in Germany, Austria, and the Netherlands, where there's a substantial literature on their use. That used to be the case, but now there's a substantial literature in English as well that you can find, so you don't have to be able to read German to read about the proteolytic enzymes. Let's look at the next slide, please. Clinical use of enzymes, part 2. The Wobemugos company of Germany developed enzyme products in the 1930s, and they've done decades of research. In the 1960s, they found that their product was effective for relieving herpes zoster, shingles. A research study comparing enzymes with the antiviral drug Zovirax was carried out in 1990 and found the enzymes to be equally effective. Of course, the enzymes are actually superior because there are no toxic effects compared to the pharmaceutical. Let's look at the next slide, please. Clinical enzymes, clinical use of enzymes 3. Proteolytic enzymes are also antiviral. I first heard about proteolytic enzymes about 30, 35 years ago at the beginning of my practice. And the doctor that told me about it said that whenever he catches a cold, he takes the enzymes because they take care of viruses very quickly. The enzymes dissolve the capsid. RNA and DNA are very fragile and they break down very quickly, but the enzymes break down the protein spikes on the surface so that the virus is unable to attach to tissues. And if you have a high enough dose, it'll completely dissolve the capsid itself, which is a protein sheet that wraps around the RNA or DNA. So proteolytic enzymes were used for treatment in China from the beginning of the pandemic. And so in addition to the Chinese herbs, they're using the enzymes and they're using vitamin C. And a couple of important things about the enzymes is that the dosage is important. Excuse me again. The dosage is important. I use them a lot for soft tissue injuries and for inflammation. So if someone has a lot of joint pain in lots of joints, they have to take more enzymes. If they have just one small area that's painful, then they take fewer enzymes. If we're trying to prevent heart attack or stroke, probably a low dose, maintenance dose every day, unless they have a diagnosed condition or the blood test results show that we need to have a higher dose. The other important factor is that the enzymes need to be taken at least an hour, sometimes 2 hours away from food. Eating food doesn't hurt anything. The patient won't harm themselves, but they have to take it away from food or the enzymes get used up on the protein in food. So we have to have them away from food by at least an hour. Maybe a half an hour before eating is enough to get them into the blood. So let's look at the next slide, please. A little bit about the history of the enzymes. The British developmental biologist John Beard made outstanding contributions to the life sciences. Beard deserves to be included among the leading biologists of the late 19th and early 20th century and was hailed as a forerunner of the present-day theory of cancer stem cells. He recommended the therapeutic use of pancreatic enzymes in treating cancer and other diseases. This therapy created a worldwide controversy, and although it was rejected during his day, it persists in the world of complementary and alternative medicine. And in all of the natural cancer therapies, the enzymes are used for two purposes. One purpose is anti-inflammatory because inflammation promotes cancer progression and it promotes metastasis. Now, if I have a patient or even hear about someone who gets a biopsy, that's going to increase all the inflammatory factors. So it's extremely important to take the enzymes even for a biopsy, but especially at any kind of surgery to prevent metastasis. In fact, any of my patients that has surgery, I have them take massive doses of enzymes for 3 to 5 days after the surgery, as soon as they can put something in their stomach. No need to take them ahead of time, and then cut the dose in half for another 10 days. This prevents scar tissue and adhesions from forming. And I know this to be true from a number of experiences because I've had patients come to me with scar tissue and adhesion problems that we were able to completely correct using the enzymes. I've had patients come to me with heart conditions that were completely corrected by the enzymes. And we have the blood work to prove it, the prothrombin time, the fibrinogen results, the results of D-dimer more recently. And the other reason for using the enzyme in cancer patients is that the cancer tumors disguise themselves as normal tissue with surface antigens. And the enzymes can erode the surface antigens and they can expose the tumors to immune surveillance. So I use the enzymes for cancer, for pain, for inflammation, for cardiovascular disease, and for viral infections. They're one of the most important parts of my treatment for any chronic disease. So the next slide, please. So supporting natural immunity. Now that we've seen how important natural immunity is, we've already seen some supports, drinking plenty of water, vitamin C, vitamin D, that kind of thing. But supplementation with cultured shiitake mushroom and rice bran increases resistance to infection and reduces the incidence of influenza-like illnesses in elderly subjects. This has been researched and studied again and again and again in Japan, in China, in Spain, in Italy, in the US, I think in Mexico, in the UK. And we're talking about clinical training. There are, of course, animal studies and that kind of thing, but we've got a lot of human clinical studies that show this to be the case. So in addition to enzymes, this is the other thing I use for practically all my patients, and definitely all of the patients with cancer or with a chronic infection. Let's look at the next slide, please. So BioBran is known by a number of names, but it's rice bran treated with the enzyme from shiitake mushroom. Now, both shiitake and rice bran have their own immune system properties, but when you have the process of fermentation involved, the result is rice bran arabinoxylan compound, which is found in neither of the two raw ingredients. It's made by a unique patented process. And a broad spectrum immunomodulator, I'll explain that next. Let's look at the next slide. Well, there's shiitake. Shiitake is called forest mushroom. And the forest mushroom grows, and they drill little holes in tree trunks and grow the shiitake. When you pick them right off the tree, and I've done this before, and make a soup or something with it, it's absolutely delicious. And I love to eat the mushrooms. But the immune factors in shiitake, like most mushrooms, it's sort of rubbery, so it has lots of very large molecules. There's a molecule called beta-glucan, which is immune boosting, but the molecule is so large, it's very difficult to absorb. And in fact, when it was first discovered, scientists said, well, this looks important, but I don't see how anyone could absorb it. When you have the fermentation process, though, you're breaking it down into smaller components, and you get different compounds like the RBAC, the arabinoxylan compound, and these have a much smaller molecular size, and they get absorbed right into the system very efficiently. So in the next slide, we already had a glimpse of it, is rice bran. Rice bran has a very pleasant, sweet, nutty taste. I've used it as a sweetener. I don't use sugar on my morning cereal. I eat sugar, every now and then. I'm not a Puritan. I'm just not an addict either. But rice bran is quite pleasant and quite sweet, and you can use it as a sweetener to put on cereal if you like. And it has beneficial properties. It's loaded with B vitamins. Let's look at the next slide. This is the process. It's extraction from hot water. So people have asked me, oh, I don't want to. They heard about, the product comes from Japan, and they're afraid, oh gosh, the shiitake, what if they're radioactive because they had that problem with the nuclear power plants and all that? Not a problem. The company that manufactures it has pharmaceutical grade mycelia, which are the root-like threads from the shiitake mushroom, and they use this to culture the rice bran. So this is all done with a pharmaceutical level process. This could be classified as a pharmaceutical drug if they wanted to, because it meets all the criteria. But in order to keep it available so that people can buy it over the counter, they decided not to do that. Let's look at the next slide, please. Here are the benefits. Immunomodulation, I'd like to explain that in a minute. Maintains a strong immune system. It's safe over a prolonged period of time. It does not cause overstimulation. In other words, a lot of supplements, people take them and the system adapts to the supplement, and the supplement stops having its effect. It levels off, and then maybe even the effect deteriorates. So number 5, it does not lose efficacy over a long period of time. And the effects of it can be maintained at a very low dose. Can we look at the next slide, please? How does it work? So a number of different immune system activities have been studied. It elevates immune activity to match the challenges of today's environment by augmenting natural killer cell activity. Notice that it increases the activity of it. It increases B and T cell counts. It's anti-inflammatory and antioxidant, antiviral action, influenza, herpes, HIV, and it's been studied in human trials with HIV. It supports healthy cytokine activity levels. And I've also found that in cancer patients who have low white cell counts, it helps to raise the white cell counts into the normal range, or at least it helps to stabilize them so that if they get low, they don't drop too low. I feel like it's protective even in patients who are getting chemotherapy. So I'd like to see the next slide, please. Natural killer cells. Natural killer cells are essential to early defense surveillance function of the immune system. They rapidly release cytokines, gamma interferon, interleukin-4. They attack cells that have been affected by microbes, and they collectively regulate multiple aspects of essential immune responses. Now, so their function is to destroy virus-infected cells, to destroy microbes themselves that are swimming around in the fluid environment, and their natural function is to destroy unhealthy cells or dead cells. Every cell in our body has a natural life, and when the cell is dead, it has to be broken down and eliminated, and that's what the natural killer cells do. Let's look at the next slide, please. The cells attach themselves to the abnormal cell, whether it's an aged normal cell or an infected cell with a virus, or if it's a bacterium, or if it's a malignant cell, it attaches to the cell, it injects granules filled with, guess what? Enzymes, special enzymes, and the enzymes explode the cell into tiny, tiny parts so that it drains out and is quickly eliminated from the system. Let's look at the next slide. Now, the NK cells, people who have low NK cell activity or deficiency are more susceptible to cancer, autoimmunity, infections, particularly chronic infections, fatigue syndrome. Let's look at the next slide. So with BioBran, a statistically significant increase in NK cell activity was measured within 2 weeks. And I've seen tripling and quadrupling. And here we're seeing a very significant increase in the activity of the NK cells. See, when the NK cells are traumatized, they'll just sit there. They don't do anything. They don't die. They don't get better. They don't get worse. They just sit there. They don't attach themselves. So the cancer cell or the virus-affected cell will go swimming by, and the NK cell just sits there and watches. Let's look at the next slide, please. So MGN3 is one of the names of BioBran, one of the commercial names. And this was an early study that was done that found that you need to take an appropriate dose in order to get the NK cell activity elevated. So the NK cell activity was increasing because of using the BioBran. And let's look at the next slide. So I mentioned that it's an immunomodulator. Immune modulation means that it's a smart supplement. It's a smart molecule. If there are pro-inflammatory cytokines that need to be produced in a cancer patient, like gamma interferon or tumor necrosis factor alpha, they will increase. But if there's a lot of tissue inflammation, pathological inflammation for something like, say, it's rheumatoid arthritis, and suppose that the tumor necrosis alpha is elevated, it will decrease. So it feeds the immune system and gives the white blood cells the information and the strength that they need the glucans, alpha glucans, RBAC, so that they can perform the function that they're trying to perform. Next slide, please. So for specific health issues, 3 grams a day for a month and then reduced to 1 gram a day. That's more like the cancer patient. I haven't seen any infection cases that were bad enough to where I had to use a dose that high. But most people, I give them 1 capsule twice a day if they're healthy and exposed and at risk, or 2 capsules twice a day if they have symptoms. If that's not enough to get the symptoms under control quickly, I mean within 48 hours, then we increase it. And with children, most children, small children, 3 or 4 years old, they're too small to be able to swallow a capsule. So I just have them chew it up, because it's not candy, but it has a little bit of that sweet rice bran flavor to it. And most children I've seen don't mind just chewing the capsule up and swallowing it. So let's look at our next slide. Safety. It's proven non-toxic even at extreme high doses. Over 400 patients in clinical trials, tens of thousands of users globally, no reported side effects or drug interactions, and has been used effectively for more than a decade in Asia. So let's look at the next slide. Prevention of thrombosis. Now this is important. This is the last section. I want to say one more thing about NK cell activity, though, before we go on, because NK cells are very, very sensitive to trauma. And they've been researched with every kind of trauma you can imagine, from self-criticism, divorce, earthquakes, hurricanes. Dozens and dozens of studies have shown that NK cell activity goes down when there's trauma. So this is the reason why the number 1 cause of late death in trauma is infection. Because if the trauma doesn't kill you, if you don't bleed to death, if the blow to the head doesn't kill you and cause brain death, 3 to 6 weeks later, pneumonia and death, because the NK cell activity goes down. So for this reason, patients that have come to see me, I give them proteolytic enzymes after surgery, but also to protect their immune system, have them take the BioBrand. Or if someone has a car accident or some type of trauma, just went through a bad time, they lost a loved one, they're going through a divorce, I take them, especially at the change of the season, to protect the immune system, because the NK cell activity is going to go down from the trauma. So that's a very important factor. Now, speaking of proteolytic enzymes, we know that they dissolve fibrin. Nattokinase is an enzyme from the fermented soybean food, natto, and they've been thoroughly researched for their beneficial effect on cardiovascular disease. A study at Miyazaki Medical University in Japan showed that nattokinase is an angiotensin converting enzyme inhibitor. How's that for a good treatment for prevention problems with ACE2? ACE causes blood vessels to narrow and raise blood pressure. The study showed that with a dose of 200 grams after 4 days, 80% of the subjects had a 10% reduction in blood pressure. Now, I don't recommend using nattokinase as a standalone treatment for blood pressure. But blood pressure is not what kills us. Blood clots are what cause strokes and heart attacks. So it's important to have nattokinase or some kind of proteolytic enzyme for treating the blood clots. And if it can lower blood pressure, then that's a very pleasant side effect. But for people with high blood pressure, I don't use the nattokinase products alone. I use them along with, I use botanicals for that, especially crataegus and passion flower and herbs like that. So let's look at the next slide, please. Here's natto. A lot of people really don't like it. It's stringy and sticky and has a little bit of a bitter flavor. It's usually served with some hot mustard and soy sauce and I love it because it's a food that when you eat it, it makes you feel good right away. And even if you feel like you've overeaten, you can take some natto, and those enzymes will get in there and digest everything that you've overeaten that's sitting there in your stomach. Anyway, that's enough about natto. You can go to the next slide, please. So this is fibrin creating a blood clot, and the enzymes from natto kinase, dissolve this, as do all proteolytic enzymes, because fibrin is the blood clot protein. Next slide, please. There are 5 enzymes in natto kinase. The Japanese product NKCP contains the active ingredient, the enzyme bacillopeptidase F. This product targets thrombosis both for prevention and also to break down existing thrombi. So a person who already has blood clots in their bloodstream, you can dissolve them with this. Let's look at the next slide. So natto kinase has been studied a lot, but in many cases, what's actually being studied is the bacillopeptidase F, which contributes to maintaining the healthy blood flow. Now, natto kinase and proteolytic enzymes are sometimes referred to as blood thinners. And doctors will often say, don't take it before surgery. Well, you don't need them before surgery. You don't need them until after surgery or after an injury, but they don't thin the blood the way the classic blood thinners do. They're a blood thickener preventer, for lack of a better term. They prevent the blood from coagulating, but they don't thin it beforehand. So you don't get unpleasant symptoms of dizziness or lightheadedness or any of the other unpleasant effects from a blood thinner. So we can see here on the lower right, in the red, the active ingredient, bacillopeptidase F, is the active ingredient of NKCP. Next slide, please. The cardiovascular benefits of NKCP are obviously its anticoagulant activity, so it prevents blood clots from forming, thrombolytic activity, it breaks down existing blood clots, and that's going to include the micro blood clots that are in the lung tissue that could be contributing to long COVID. And third is blood viscosity reduction activity. Let's look at the next slide. Here's one study that was shown that this used the NKCP in a vial, and different substances were added except to the control. A thrombus was formed by stimulation of the coagulation system, and all of these substances were put inside the tube. After 3 to 5 minutes, gently adding fresh human blood immediately after collection into the test tube. Let's look at the next slide, please. Oh, okay, this one's forming, sorry. A thrombus formed by stimulation of the coagulation system in the TVA and the subtilicin after 10 minutes because of the thrombolytic action. After 3 to 5 minutes, but no thrombus was found because of the anticoagulatory action of NKCP. It was as effective as heparin. So that's okay, we can go to the next slide. Well, no, go back to the previous slide, just briefly. So what this shows is that the NKCP has a preventive effect on blood clot formation. Okay, now we can go to the next slide. So something abnormal might be happening in the blood vessels, but with NKCP, all those factors, obesity, alcohol excess, tobacco use, stress, genetic predisposition, aging, lack of exercise, all of these factors can cause abnormal things in the blood vessels, and all of them can be corrected into a healthy blood flow using NKCP. Now, it's beneficial in preventing thrombosis, such as in cerebral or myocardial infarctions. Next slide, please. So here's what happens to the blood parameters with NKCP. Actually, these are summarized in the next slide. I don't want to run out of time here. So let's look at the next slide. What we see is that cholesterol goes down. So lipid metabolism is improved because the LDL cholesterol goes down. Triglycerides go down. And the HbA1c goes down. The C-reactive protein, the HSCRP goes down. And a surprise, a factor of body weight also went down. So we saw that it helped control blood sugar, lower triglycerides, and lower inflammation. Next slide, please. And if you take NKCP over a period of time, there are cumulative effects. The immediate effect is prevention of thrombosis. But then later we see improvement of fatigue, which is probably just from having an enhanced circulation, so there's more oxygen available. And here we see next is some symptoms. Now, these have been studied in human trials. We've seen improvement of stiff neck and shoulders. We've seen improvement in dizziness and headache. And we've seen warming of cold extremities. This takes a few months to occur. Now, my main reason for using NKCP is when I have patients who I feel are at risk for cardiovascular problems, or who have had some type of problem with taking a vaccine. I'll have them take it to try to prevent long COVID, if possible, by trying to attack the microclots that may be affecting not only the circulatory system, but also the respiratory system. So let's look at the next slide, please. So who should take NKCP? Anyone who's been vaccinated for COVID, especially with the mRNA technology. Anyone at least 60 years old, especially those who have been taking aspirin to prevent cardiovascular disease, and anyone who has a significant sugar habit. We've heard for decades about the dangers of cholesterol. My opinion is, and I've got, I feel like, plenty of documentary evidence that supports the idea that cholesterol, except for one rare type of cholesterol, VLDL, is not a risk factor for cardiovascular disease, but sugar definitely is. And sugar raises triglycerides, which leads toward very low density lipoprotein accumulation, which is a threat. Anyway, people who have a bad lifestyle, sometimes I like to give them a supplement, but really the lifestyle correction comes first. So let's look at the next slide. Here's some of the research, and I think this is a research that, which one? Oh, okay, yeah, the third one, Stosky, Katso, and Zhu. This is the one where they did symptoms of a headache and stiff shoulders and cold hands and feet, and found that taking NKCP after 3 or 4 months improved those symptoms. Now, I've used NKCP for headaches. It's not as fast acting as aspirin, but for a really bad headache, it can shorten the period of time that people have pain. But the main reason I think to use NKCP is that it's as strong as a pharmaceutical drug for treating potentially lethal problems from thrombosis with people at risk for cardiovascular disease. And let's see the next slide, please. Recommended dosage, 125 milligram capsule of NKCP twice a day. Now, sometimes I raise that. I have doubled it, but that's after looking at blood work. If the blood work looks threatening, then I like to start it at a higher dose. If the blood work doesn't improve, then I like to raise the dose. But generally, that's enough. And that's what I would recommend for someone who is at risk for long COVID from having the infection or from having the vaccine. So just to summarize everything, you can go to the next slide. Now, I think now that's the last slide. Just to summarize, the use of NKCP and BioBran is optimized if we can get people to improve their lifestyle, to have a decent diet, to get some exercise, to control their blood sugar. And if they'll use vitamin D and vitamin C, this is what I've done with my patients, and I just haven't seen any infections except for the 1 or 2 day ones that seem to clear up right away and confer natural immunity. Okay, so I hope I haven't spoken for too long, but that completes my presentation. And I'll let our moderator take over for questions.